Well, welcome everybody to our online program on addiction and recovery from the Sunshine Coast Health Center up here in beautiful Powell River, BC. And as many of you know, at the Sunshine Coast, we've been examining the assumptions and the ideas behind a lot of addiction treatment. Just trying to understand them from a scientific point of view. Is there evidence behind them? Those sorts of things. The traditional approach to aftercare has essentially been control. And you have to understand where this comes from. It's the idea that someone with an addiction is essentially powerless over the addiction. So a doctor may tell somebody, look, your liver's getting fatty, you better quit drinking, and they'll drink anyways. And in some circles, in residential treatments, for example, they might say something along the lines of, well, your best thinking got you here. So with this idea that a person with an addiction can no longer trust his or her own thinking. And this idea that if you can't trust your own thinking, then what do? Well, you probably have to rely on the experts in the field, people who've worked with addiction, people with addiction for many years. Maybe they have the answer. So the idea of aftercare became, look, once you leave treatment, here's the plan. And the plan is very detailed, and it covers any number of things. For example, it may suggest you go to 3 or more community support meetings, such as AA or Smart Recovery. It'll probably suggest some things such as if you have issues to deal with. For example, maybe you have anger issues. So go to anger counseling. Very often, if it's a treatment center, it may be a support group of alumni from the treatment center. And it'll probably deal with diet, exercise, perhaps family counseling, things like that. And so the person then would take this plan and follow it rigorously, and they would, for example, show up at the counselor's office or at the community support meeting in some sort of setting, some official place to go. And the idea was that if the person could just follow through with all of this, then presumably everything would turn out fine. And so this traditional idea was to impose this structure upon the client, and the main reason being, you got to remember, because can't trust his own thinking, right? Can't leave it up to him or her to actually, dream up something on their own. They have to have this official, healthy structure imposed, and then once that's done, then the experts in the field or who's ever helping with the aftercare would sort of back off, and then be up to the individual then to follow through, to actually get to the meeting, to get to counseling if that's recommended, to actually go to the grocery store and buy healthy foods, to avoid certain things like don't go out, just eat fast foods, keep out of the bars, all that. That's totally up to the individual. And so, again, if the person would just follow through this very detailed, itemized schedule that they have in front of them, then things would work out. So that's the traditional interpretation.